So our next speaker is someone that I came across actually in an unanticipated way, but with a common interest in nutrition. I consider myself a little crunchy granola. I routinely give out my smoothie recipe to patients that are struggling to meet nutritional requirements, but integrated oncology, complementary medicine, integrated nutrition is all like super important in cancer in general, but for neuroendocrine patients that really struggle with micro and macronutrient deficiencies, it can be a real game changer for them if they would have someone like Danielle giving them advice on how to deal with some of the side effects of therapy, or just really, just you are what you eat, and if you have more information about it, we would all probably feel better. If we were all born with Danielle at our side, we'd probably all be healthy. Okay, so Danielle Paciera is our integrated nutritionist.
My dad might argue with you. How many of you are feeling tired? Yes, stand up. Stand up. Everybody stand up. Because I was feeling tired. I am feeling tired. Turn around. Do something. Do jumping jacks. Okay, I need to get out of here. Okay, great. So the integrative nutrition model is not one that's very well known in our oncology circles. My main goal today is not necessarily to show you what I do with patients, but it's really to introduce the model to you and to show you how much science is behind it. And I'll give you a little bit of an idea of what it looks like in practice. So as we go through, I'm going to explain the model. And in doing the explaining part, I'm going to contrast it a little bit with dietetics, which is the more familiar model to most of you. How many of you treat patients or are one-on-one with patients? Okay. Because how many of them ask you what to eat? Yeah, so many of them. So you need to know something that you can tell them at least. So I'll tell you the two things you don't want to tell them too, give you some alternatives, and then again show you what a little bit of it looks like. It was suggested that I talk about the controversial sugar cancer issue, so I'll touch on that too. So I think we all need to equip our patients with a toolbox. This is very distracting. With a toolbox to be able to fight the cancer. And food, specifically the compounds in foods, have pleiotropic effects. So I look at nutrition as one whole set of tools, kind of like a set of screwdrivers in a toolbox. You have your flathead and your Phillips head and different sizes of each, right? So nutrition can really do that. And when we incorporate nutrition, we can improve nutritional status, which is going to improve well-being. How many cancer patients struggle with well-being? We can improve fatigue, quality of life. We can improve response to immunotherapies, response to cancer treatments. So it definitely has a big role. When we look at things from the dietetic perspective, it's usually a this for that kind of thing. A dietitian is going to be more concerned with, okay, you need to get more calories because you're losing weight. Well, it's not that simple with cachexia. Dr. Maluccio mentioned, we need to understand that we are what we eat, but in functional and integrative medicine circles, it's not just you are what you eat, it's what you eat, digest, assimilate, use, etc. So it's not really that simple. Where dietitians are very helpful is helping patients overcome those hurdles that interfere with feeding. So the mouth sores, the dry mouth, the nausea, the vomiting, taste changes, smell changes, figuring out what to eat when, or how to feed yourself when you have that debilitating fatigue. But when we look at things from an integrative model, it's a lot different because we're looking at root-based causes. We're looking at roots of symptoms. So if a patient has diarrhea, why? We're not just going to say, eat a brat diet. We're going to look at what's going on with the microbiome. And in 2011, there was an article by Hanahan that talked about mechanisms of cancer, hallmarks of cancer. So when we're looking at things from that integrative model, we're going to look at Roots of symptoms, we're also going to look at roots of disease. You don't need to worry about the specifics. There's no way I can cover everything on every slide. I have a lot of references, and I think you can get them all online, but my email is at the end, and I'll be happy to send you. I think at last count it was 42, but I found a few more today, so it might grow. So basically, what we're trying to do is address some of those hallmarks, going from that root cause approach. We know that a lot of cancer therapies really deplete patients, and they're already coming to us somewhat depleted. Vitamins and minerals are cofactors for enzyme reactions. We're enzyme reactions. The body's not going to work well in the face of cancer especially, but even in the absence of it if a person's not nutritionally optimized. So that's definitely something we want to target. You know, there's some metabolic dysregulation in cancer. We definitely want to address that. And we'll talk a little bit more about that too. We definitely want to modulate the microbiome, improve the internal ecology, because if we don't do that, we're only going to get so far with doing as much as possible restoring the immune system. Really, it's not just about surviving. It's about thriving. What is the point of extending years in a person's life if they're not quality years? So we don't want to just help patients survive, we want to help them thrive. Okay, first mistake. Nutrition is never neutral. Everything you eat will have an effect on your body. It can either further feed dysfunction or it can help restore balance and function in the body. So when a patient asks you, what should I eat? The one thing you don't want to tell them is it doesn't matter, because it really does. The second thing you don't want to tell them is you need to get more calories, you're not eating enough, so drink Boost and Ensure. By no means. So Boost, this is the label from Boost, and you can see I fixed it a little. It's full of inflammatory compounds. The sugars in here are known to increase certain inflammatory cytokines that are associated with more malignant states, not something we'd want to do. High sugar can also feed a low-grade inflammation. The oils in here are highly inflammatory. They're known to upregulate the production of inflammatory thromboxanes and iconosoids. Milk protein, it's adulterated. It has higher levels of IGF-1, not something we really want to drive up. And then the slashes you see on here are not really bioavailable nutrients. So they're kind of just in there for label fluff. When you look at this from just a calorie standpoint, where the dietitians are coming from, it's usually about calories, not necessarily quality of calories. So yes, it can be a good source of calories, and it might look like it has vitamins and minerals. That's basically fluff. So it really doesn't have much behind it. It's 360 calories, 45 grams of carbs. That's kind of a load. 24, that's more than half, come from sugar, and there's only 1 gram of fiber. There are 14 grams of protein, but you know, it's not that great a quality. This, on the other hand, is therapeutic. No inflammatory oils, no inflammatory sugars. 1 avocado has 240 calories, 13 grams of carbs, 10 grams of protein, and 10 grams of fiber. And the fiber is a fiber that the microbiome loves. So it's very microbiome modulating. There are over 20 essential bioavailable, unlike Boost, non-bioavailable in Boost, bioavailable essential nutrients. And there's 10 grams of fiber, and some of the compounds in avocados have been shown in vitro to have cytotoxic benefits. So one thing I want to mention before I go any further is normally it's said that double-blind placebo trials, randomized trials, are the gold standard. But you either know you're eating an avocado or you don't. So we have to look at things with a little bit of a different lens when we're looking at food-related studies. And there was one study that I think was published in 2023 in which men who ate 1 serving a week of avocados had 15% 15% fewer cancers. And that's not risk, that's incidence. And it was both initial and reoccurring cancers. So do you know what one serving is? Anyone?
A quarter of an avocado quarter.
A quarter a week, 15% fewer cancers. Of course, there's going to be other variables in a study like that, but I mean, that's pretty significant. And then you see a coconut up here. If you get a can of Trader Joe's coconut milk, it's very clean, it's a good brand. It's 660 calories. Yes, a lot of those calories are fat calories, but a lot of the fat in coconut oil is medium chain triglycerides, which are wonderful for anyone with any malabsorption. People who have cancer, whether or not they're receiving cancer treatments that target the gut or not, their gut takes a hit. The microbiome takes a huge hit. I mean, you can argue that it's already disrupted before a person gets to you with their cancer diagnosis. The fat that isn't medium chain triglycerides comes from some key saturated fatty acids that also have anti-cancer benefits, the lauric acid, the caprylic, the capric. So if you made a shake with half of an avocado, half of a can of coconut milk, it's going to have over 500 calories versus 360. It's going to have 5 grams of fiber, microbiome modulating fiber versus 1, no inflammatory sugar, no inflammatory fat, and if you add maybe a little bit of collagen to boost up the protein, that's at least 12 grams versus 14. It's not that much different. And then you have a wealth of bioactive ingredients, especially if you start working in the medicinal herbs and the spices. Matcha is very medicinal, especially when it comes to cancer, and we'll talk about that. Cacao is yummy, and if you put the matcha in the cacao, you get a little and it tastes good. So precision medicine, we've heard a lot about it. Integrative nutrition is really precision nutrition. Everything is very highly individualized. Okay, here it is. If you're not familiar with the Warburg effect, I would encourage you to read about it because I think that this is where it started. In cancer cell, there is definitely an upregulated use of glucose, but it's not really that simple. I just liked this picture. I thought it explained things very well, and it's in the references. Everything you see on the bottom of the slide is in the references. So, I think we need to look a little bit more globally and think beyond just sugar, but what happens when a person eats a lot of sugar or eats a lot of carbohydrates? And in a state of cancer, there's a little bit more insulin resistance already. So if somebody's dumping in 45 grams of carbohydrates, it's not really good because insulin resistance can drive a more malignant phenotype. In insulin and IGF-1 activate the tyrosine kinase receptor, growth receptor, which is going to drive tumor proliferation, upregulate malignant pathways, et.cetera. And then, of course, there's that low-grade inflammation with the inflammatory cytokines IL-6, CRP, as well as TNF-alpha, as well as CRP and fibrinogen. My mouth hasn't worked all day. And then that's going to further proliferation, something we don't want. And then a notable thing is IGF-1 can interfere with cancer therapy. I don't know if you've run into that with immunotherapies, but it's something I did read about. But cancer cells are like dumpster divers. They're very adaptable. So you can knock them down a little bit if you take sugar out of a person's diet, but they can upregulate other pathways and start using fatty acids and amino acids. So what do we do? You know, if you tell one person, you know, maybe keto diets are good for one person, but for another person, they could be a kiss of death. That's where the precision part comes in. But ultimately, for everyone, there are going to be things across the board: blood sugar modulation, anti-inflammatory diets, foods with a lot of medicinal value, because nothing is going to be neutral. It can either further drive dysregulation, or it can help the body come back to a place where it can do what it was designed to do in the way it was designed to do it by nature, which is essentially to eradicate these, or detect and eradicate these mutations before they have a chance to develop into cancer and grow. And that's where nutrition really comes in, or it's one of the places, because there are many. So what does this look like? This is the Hanahan article. This is the 2011 Hanahan article that talked about the hallmarks of cancer, or that image is from his original article. He updated that in 22 and 23 and again in 24. So I don't even know at this point how many hallmarks we have. When we're talking about the approach, the integrative approach, again, we're going to look at roots and driving causes. And if you look in the literature, you'll actually see these terms used to describe the actions of phytonutrients in foods. It's some of the same terminologies you'll see used to describe mechanisms and hallmarks of cancer. And there's a lot of research. This one is a few years old, but I really liked it because it talked about the heavy hitters, which are curcumin, resveratrol, genistein, ECGC, sulforaphane. I put into PubMed cancer stem cells and phytochemicals, phytonutrients, and I had 15,000 hits. There is an astounding amount of research in the area, and it goes back decades. It's more than you can read in a lifetime, most likely, and it's just constantly pouring in. If you put curcumin in cancer, you'll get over 7,000. Genistein will give you over 5. Resveratrol over 4,000. ECGC over 2,000, and sulforaphane is over 1,200. That's a lot. So when you read foods that fight cancer, or phytochemicals that can target stem cells, or whatever term you want to use in PubMed, these are the foods, or rather the phytochemicals, that you'll see most often brought up as far as having those pleiotropic effects. And it's not just direct anti-cancer benefits, but there's also immune modulation. And a place where this is really exploding and it's really fun is the medicinal mushrooms, because they have direct anti-cancer benefits, but they also have a tremendous amount of immunomodulatory benefits. That's why the marketplace is just flooded with mushroom everything: mushroom coffee, mushroom chocolate, mushroom hand cream. But a lot of those products don't have the active beta-glucans, because there are different types of beta-glucans. So they don't have the active types of beta-glucans that have been studied. There's one company that has an exceptional quality product that I do like. And there are 2 companies that actually have their products in clinical trials.
What's the company? U-I-N-U-L-I-F-E?
No. The first clinical trial was done with Paul Stamets. Host Paul Stamets, he's the mushroom fungi perfecti guy. Host Defense is his company. The company that I like is Real Mushrooms.
Real mushrooms.
So I mentioned all of those phytochemicals, all of those phytonutrients. These are the foods that contain them. So I have a lot of slides. I didn't do that. Did it do that to you? Go back and use these for your own reference. When people are asking you, what should I eat? Just pull this out. You might even print it big and show people. Okay, so, yeah. And I think you can download this from the website. At least I was told that you could. And my email is at the ends, so if you can't, I'll send it to you. And the references. If you ask for the PowerPoint, you're getting the references. And I want you to read some of those too. Okay, so when we're putting together a diet for a person, and let me just say, I'm an integrative nutritionist. I'm talking to you about nutrition, but it's not all I do. It's one piece. I integrate a lot of things. Diet is a foundation. Food, what we eat, it's a foundation. But we talk about a lot more than diet. I don't even talk about what to eat directly with patients in the first session. But when I'm putting together something, blood sugar modulation, blood sugar balance is big. Balanced diet, balanced pleasure with therapeutic foods. That balance means a lot of different things. Certainly, we want to see, my hand wasn't even on it. We want to support the microbiome, which you can see now is the next slide. And the way you do that is by eating a diverse diet. The hallmark of a healthy microbiome, is a diverse one, and you can't have a diverse microbiome if you don't have a diverse diet. So eating a lot of different colorful foods. The microbiome loves color, loves aroma, just eats those things up. And then a lot of the fibers too. You don't just do it one day a week. You do it every day for weeks and months and years, especially cancer patients. And anti-inflammatory. So this article is one of many, 2 more of which I found today that are probably going on that list that talked about the microbiome. And this and the next slide are just quotes from that article. The main reason I'm putting a slide about microbiome or 2 is because the microbiome and the immune system have pretty much a 1-to-1 correlation. It's like, I didn't have my hand on there again. It's like the, is there AI in this computer? It's like the bees and the flowers. You know, you're not going to have flowers for very long if you don't have bees. The immune system won't work well very long if it doesn't have a healthy microbiome telling it what to do and how to behave. So when I went back and looked at these slides after not having looked at them for a while, I was like, man, that's a good quote. Did it really come from that article? Because it seems like something I would say. But unfortunately, I'm just going to hold them so y'all can see I'm not touching. I did not say that, but it really talks a lot about this whole precision model. And, you know, you spoke to the multidisciplinary team. Well, integrative approaches integrate a lot of different types of clinicians and a lot of different modalities into one treatment plan. And we need to consider it all because we need our patients to have every tool they possibly could ever need to fight this fight. It's not an easy one. So foods that feed the microbiome, this is something to go back and refer to. I didn't do that again. I'm not going to read them, but I can see you're taking a picture, so I'll stay here longer than I had intended. I'm going to go over now. Kidding. Okay, so what do we tell patients when they hit you with the question, but what should I eat? Don't worry so specifically about foods other than those anti-cancer foods. You want to teach them skills. You want to give them bullet points. The biggest bullet point is half of what you eat should be plant-based foods with high medicinal value. Ideally vegetables, yes, a little bit of fruits. There should be some protein, but it should be anti-inflammatory proteins. Clean proteins, not necessarily what you get in every grocery. Definitely anti-inflammatory oils, not the canola, safflower, sunflower, soy, whatever, grapeseed. And then herbs and spices, I can't tell you how wonderful they are. You get so much with a little bit. I can't quote anything about this study, but there was another study that showed significant impacts from eating a tablespoon a day of parsley. A tablespoon of parsley. That's not a lot. Let's see, it went way far. Nope, okay. And then the carb portion you see on here is not factory adulterated foods. We want our foods to come from a farmer, not a factory. Whole wheat bread doesn't grow on trees. Once a food goes to a factory, it's dead and devitalized. Patients who thrive are vital patients. They're not going to be vital patients without vital, fresh, whole, real foods that come from a farmer, without going to a factory before they get to the plate. If we want to support diversity, aim for 5 colors. get in those therapeutic anti-cancer foods, at least one a meal. Ideally, every day, people should be eating the dark green leafy vegetables like collard greens, mustard greens, kale, turnip greens. We're lucky because they know how to cook them around here. Cabbage, watercress is a heavy hitter too. It's not nearly talked about enough. It should go into every shake. I should have said it up there. So basically, we want to tell people, shove everything you can into every bite as far as micronutrients and phytochemicals. Eating the rainbow, same, at least 5 colors, but at least like 4 different greens and maybe 2 different blues and a few different reds, different oranges, different, see? Etc. When I talked about anti-inflammatory oils or not inflammatory oils, here are examples of them. Avocado is great for high heat. Next, coconut, then olive oil. You don't want to heat the flax and hemp. And definitely herbs and spices at every meal. There is this misconception that eating healthy is boring. What happens when we eat these factory-based diets is our palates become desensitized, and we have to have a lot more fat, a lot more salt, a lot more sugar for things to be enjoyable. But when we start eating real food, the palate becomes resensitized, and we start to taste things that have so much more flavor than we ever realized they had. And when you work in the colors, that lends a whole visual appeal. When you work in the spices and the herbs, that lends a lot more flavor. If you use different textures, different cuts, different shapes, etc., then it brings it up a level as far as the pleasure. So be creative. No, it doesn't have 5 colors, but I can lie and tell you that it has herbs you can't see in the dressing. So our patients, again, we want them to thrive. We don't want them just to survive. And I am somewhat biased, but I don't think you're going to have patients really thrive if you don't address the whole nutritional component, because it impacts every aspect of a person's health. And it may not show up in the here and now, but it will show up. That's it. So here's my email address. Take it down and email me if you want to wait for questions until the end. Do you want to do that, or do you want me to answer them now?
Oh, no, why don't we answer them now? Because if you were to gauge a talk on the number of people that were taking pictures of your slides, I think we pretty much hit it out of the ballpark.
Yay!
So,
Okay.
Why don't we take some questions?
So, I love your talk. I hate your talk because it means I have to stop eating Pop-Tarts for breakfast.
No, it doesn't. No, you can eat them, but know what they do.
My microbiome is black. The more important question for me, I live a life where I probably could afford, I really could afford to do this. Whether or not I choose to is my problem, right? I work with a lot of patients who really, I honestly, barring some divine intervention, I really don't think can afford, and I actually know because they've told me, really cannot afford a lot of fruits and vegetables and fresh things. And so what suggestions do you have?
Well, there are some resources. There's a market match program at the Crescent City Farmers Market, and they'll match food stamp programs. And then there are community gardens, and the number of them is growing. There are CSAs that, if you don't have money, will allow you to work for your produce. There are, in the Bywater, some community fridges, and I know some farmers that stock those fridges. So there are some, and there's a program where doctors can write prescriptions for vegetables, and I think right now that's only covered for diabetes. Prescriptions can be written for WIC mothers too, and for a certain amount of time for their children.
Do you have any other suggestions? I don't live here, so, but do you have any other suggestions of just in general, try to follow these guidelines, right? But, are there any other things that they can be doing, if they really can't afford, or if there aren't a lot of resources in their area, aside from just trying to eat more fruits and vegetables and trying to be more creative and colorful? But, are there any other thoughts on, for people who really don't have resources in the middle of nowhere, Louisiana?
Frozen, frozen.
It's reasonable.
Frozen is going to be reasonable. It's ideally organic, but if they don't have the ability to pay for something like that, getting something in rather than not getting it in, you have to weigh everything. And ideally, fresh is best, yeah. Frozen is going to be the next best. Canned, some canned things aren't as bad, but it's not really going to touch frozen or fresh.
Sure. Okay, so frozen foods. Got it.
Yeah.
Hi, Mary, retired pediatrician. I wish to contribute something amazing that supports everything you have just already said in your fantastic lecture. About 2 weeks before I went to Houston to care for my first cousin, who has sadly metastatic lung cancer, I had read a very exciting article about the fact that in 2020, 2021, and 2022, increasing in number each and every year were placebo-controlled double-blinded studies published all over the place in how whole food nutrition is garnering cure for cancers, amelioration of their symptoms, improvements in the patients, above and beyond and apart from chemotherapy or radiation. In intense, deep article. So
Yeah, there are a few.
because as a pediatrician, my deep dive extra hobby has always been nutrition. All right. So moving from that, I had the distinct pleasure when I went to Houston. My cousin's oncologist was Dr. Jasani, who had left recently, just a few years prior, traditional medical center Houston, radiation, chemotherapy practice to really concentrate on immunotherapy. My cousin is now in her second round of immunotherapy, 3 and doing brilliantly better already. But when I'm in the meeting room with him on that Friday, I was so thrilled to meet him because CB was like this. I waited patiently. They had their turn, husband and wife, he gave his directives. Then I boldly stood up and said, I wish to most humbly ask you to let them know how important your topic is to her improvement, right? So I was trying to come through that door very quietly, and I said, I just read this fantastic article on what's been published in 2020. I couldn't finish the sentence. He knew exactly the article. And we took off talking about your area of expertise and how it helps. So,
Thank you. Can you send me that article?
oh yes, I will certainly.
And any other one that you think I might like?
One, I like your lecture so much because I don't want to hear anyone say anything about my avocado toast in the morning. But
Avocados do grow on trees.
yes, they do. My toast is not, that's okay. I wanted to ask about, because we had a patient bring it up, who had done some research, he likes to do extensive research, on intermittent fasting with immunotherapies, and I was wondering if that was something that you
Yeah, I don't think that there's one diet for everyone. Some people, a high-fat diet's not going to be good. Keto has shown some amazing benefits in cancer, especially in the brain. And plant-based diets have shown amazing benefits. Intermittent fasting, anywhere from, I think if we're doing it pre-treatment, 24 to 36 hours, some people even 72, can improve tolerance and response to treatment pretty significantly.
As far as incorporating the foods and the oils and the spices that you recommend, and the thought next is like, how do I prepare these things, or how does the patient prepare? Is there a cookbook that you recommend that
So many.
this? Oh, okay.
So many. And one of my colleagues is here. She and I both like to cook, and if you have anything to add, feel free. Mark Hyman is a great resource for recipes. He has a cookbook that I like. I actually gave it to Jan, my colleague. I think so, didn't I? Yeah. And he has a website with a lot of recipes, and if you get on his newsletter, he sends out 1 or 2 a week. And then there are a lot of great bloggers out there. One that I like is Feasting from Home, just because her food is pretty and it tastes good. But she has a lot of things that are Instapot too. So Instapot, pressure cooking, things like that. You know, one big raw vegetable bowl, salad, whatever name you want to put to it is great for anybody, but especially a cancer patient, with a rainbow of colors in it and aromas and tastes. But certainly cooked food is not bad by any means, and some patients are going to do horrible with raw food too, especially some of those nut patients.
Okay, oh, sorry. One last thing, the microbiome mashup.
Mm-hmm.
Mention that.
So
That can be helpful in terms of if people.
the diversity, yeah. So what Jan is talking about is something that was created by Dr. Tatis Karazian, and he's big on the microbiome, as is pretty much any other integrative practitioner. And what he has patients do is get 30 different foods, blend them all up, and put them essentially like in 1/4 of a cup measure things, which a lot of big ice cube trays that are like cocktail ice cubes are 1/4 of a cup. Some of them are 1/2 a cup, and freeze them and then pull 1 out a day to help feed a healthy microbiome, get that diversity in.
Yeah, mixing it with a salad or putting it
In a shake, yeah.
Or making a salad dressing with it.
Or putting it in soup too.
Yeah. And see.
My dog's meals are like a microbiome mashup.
Awesome. Yeah, thank you